My name is Brandy, and this is Macy, and I'll be doing my Heent assessment on her. In a real setting, you would want to provide privacy and wash your hands, and then you would also want to note their appearance and their hygiene throughout the exam, and pay attention to their skin color and note their posture, and then you would also want to pay attention to their speech and affect throughout the exam. The first thing I'm going to do is look at your hair and just the distribution, and then look at the shape and contour of your skull, and then just feel for any lumps or bumps. And then through the exam, we would want to observe their level of consciousness and orientation, and pay attention to eye contact. And then you move on to the face and observe for symmetry, and everything looks symmetrical. And then you would observe for any involuntary movement. And then I'm going to feel your temporal artery, and then just open and close your mouth, and then one more time. Okay, and then feel your sinuses. And then next, you would move on to the eyes and just look at your eyebrows and your eyelashes, and look at your sclera, and it should be nice and white, and there should be no yellowing. Then you would look at your conjunctiva, and then just make sure it's nice and pink, which yours is. And then I'm going to get my light source and just look at your eyes, make sure there's no foreign bodies or anything. And then this just assesses that your eyes are equally reactive to light. Then I'm going to put my hands back here and tell me when you can see my fingers.
Now?
Okay. And then tell me when you can see my fingers.
Now.
And again.
Now.
And that just tests your peripheral vision, and it's intact. And then I'm going to have you look at my finger and follow it. And then follow it in. And that just tests the 6 cardinal fields of gaze, which hers are intact. And then in a real setting, you would use a Snellen chart to test her vision, which is where you just stand 20 feet away from the chart and then cover one eye at a time, and they read the smallest line of letters that they can. Next, I'm going to move on to your ears, and just start by looking at placement and just inspecting them for any redness or signs of infection. And yours look normal. Now I'm going to close your ear and whisper something, and you tell me what I said. Okay?
Sure. Apple.
And then again on this side.
Baseball.
Okay. And then next I'm going to look at your ear. And then this one. And that just looks at the tympanic membrane, and it should be nice and white and not red or inflamed, which yours is white. And then next, move on to your nose and just or look for symmetry or any lesions or deformity, which yours is normal. And then I'm gonna have you lean your head back a little bit, and then I'll look in your nose. And just look at the mucosa and inspect for abnormal discharge, which yours looks normal. And then next you would move on to your mouth and inspect your lips for any cracks or any lesions or sores, which you don't have any. And then get my light again and look in your mouth. And then say ah. And you would also want to grade tonsils, which yours would be a 1. And then lift your tongue up. Okay. Everything looks normal. And next you would want to move on to the neck and just assess for visually for alignment, and note that the trachea is in the middle, and look for any masses or any lesions. And then you would want to assess range of motion. Touch your chin to your chest, and then your ear to each shoulder. And then look to the left and to the right. And then tilt your head backwards. Okay. And then you would want to palpate the sinuses. And then you would want to palpate the trachea with your head up a little bit. And then you would note like any masses or lumps or anything. And then you would want to palpate the thyroid. Turn that way a little bit. Yeah. And then swallow. Okay. And then you would just note any tenderness or any lumps, which you don't have any. That concludes the assessment.